I want to at this moment go across to one of the leading pulmonologists and one of the known faces in India's medicine field, Dr. Randeep Guleria, who is joining me at this moment. Needs no introduction. Dr. Guleria, thank you so much, sir. Really appreciate the time that you are giving our channel at this moment. Sir, I want to specifically speak to you and ask you, it's a reply that the government has given in the Rajya Sabha where two important things have been said. Number one, that there is no official sanctified data related to deaths as far as pollution is concerned. And they have also said that don't go by WHO standards. They are just mere guidelines. India has its own standards, which already are 8 times higher than what the WHO says. Is there any link, sir, to people dying and pollution?
I think there's data not only from global research, but from India also, that air pollution is an indirect cause of a large number of deaths. It's a silent killer, and we are having an epidemic of deaths because of the indoor and outdoor air pollution. It's like saying that smoking doesn't cause cancer. You have no data to say that this person had any test to say that this person who smoked got cancer. But there is enough evidence which shows, epidemiological evidence and lab-based evidence which shows that that the cancer is related to smoking. Similarly, there is data which is from India. There is data from the global burden of disease. There is the global state of air data. All of it shows that not only in India but across the world, in areas where pollution is high, there has been increasing number of deaths. And unfortunately, India sort of leads this in terms of outdoor air pollution. We are seeing a huge number of deaths. The global data suggested that last year 8 million people died because of air pollution, and most of these deaths occur in the developing or the emerging markets, because of rapid industrialization and unchecked pollution control measures, the quality of air is very, very bad. There is also data from various institutes, including AIIMS, which clearly shows that when the air quality deteriorates, in the next 4 to 6 days, there is an increase or a huge surge in emergency visits by people with respiratory problem, and this is occurring in adults and children, and many of them get admitted in the ICU or land up on a ventilator, and because of that, it leads to their death. So I think you have enough evidence to show that. There is also a Lancet study which looked at the 10 city data from India last year, and this also showed that for every 10 microgram per meters cube rise in PM 2.5, the mortality goes up by 1.4%. So there is enough data to suggest that it is linked to poor quality of life, more respiratory problems, more systemic disease, and higher mortality.
Sir, does that mean what you are saying, sir? Studies you said conducted even in India, and then of course Lancet and others which have also gone in details. Does that mean that we are living in denial? We cannot solve this problem. So the only logical solution is to say, let's go by Indian standards. Let's not think about the WHO standards, the debate which is going on since 2009. And number two, then to suggest that people are not dying from pollution, so why take it so seriously?
So firstly, WHO itself recognizes the fact that air pollution is a leading killer. And as a matter of fact, in 2021, WHO lowered the standards of acceptable quality of PM 2.5, PM 10, because it realized that there was enough data to suggest that even the values that they had suggested in 2001 were not acceptable in terms of good quality air. Having said that, it's important that each country develops its own strategy and tries and sees what are the achievable levels that they can have to begin with. We should aim to have WHO levels. If you look at data from, let's say, many cities in Europe or UK or even in the US, the the AQI is usually between 10 to 20. They also have very good quality air. If they can do it, and if China could do it, I'm sure India can do it. We must accept that it is a problem and then work towards finding a sustainable and practical solution.
Sir, I want to very quickly put on air a study, in fact, which was conducted at the Gangaram Hospital, their pulmonology department, and this is a very shocking study, and I would want you to comment, in fact, on that as well. The study, in fact, suggested that whether you are a smoker or not, lung cancer is being caused in people, those who don't even smoke. In fact, doctors have said that in Delhi, toxic air is driving new cases. In 1988, 90% of the lung cancer patients were smokers. Now, 50 to 70% lung cancer patients are non-smoker. Specifically talking about the young people in Delhi, they are in their 20s, they are getting lung cancer, and breathing in air, in Delhi's air, is almost like smoking 25 cigarettes a day. The PM 2.5, particles, they penetrate deep into the lungs and they trigger mutations leading to cancer. This is a very alarming study, sir, because for most of the people, lung cancer was something which they would have thought, if you are smoking cigarettes, possibly that would be one reason. Now there are young people in their 20s and 50 to 70% cases admitted, even in Gangaram Hospital, suggest that there are lung cancer patients, those who have never smoked a single cigarette in their life.
Yes, so if you look at data from India, you will find that gradually now we are seeing more non-smoking lung cancers than smoking lung cancers. And one of the factors for this is related to exposure both to indoor and outdoor air pollution. As a matter of fact, many years ago, studies done from PGI Chandigarh also showed that there was a higher chance of women developing lung cancer, even when they were non-smokers, but you were exposed to a lot of indoor air pollution. And now there is data for outdoor air pollution also, that this is linked to lung cancer. I think the other important thing to remember is that the mutations that occur is not only in the lung itself. PM 2.5 and ultrafine particulate matter, which we see, have various toxic particles which are known as toxic hitchhikers. They attach to the PM 2.5. They go not only to the lung, causing mutation, they can travel to different parts of the body. And there is data which is emerging globally that air living for many years and getting exposed to poor quality air may itself be one cause of developing many cancers, as we are seeing in the developing world.
So 2 cam mein he will take shots so that they can cut. Let me also, before I let you go, sir, let me also ask you this. In your experience, like you said, is it lack of political will, or is it just an acceptance that we cannot, in fact, fight this battle in an effective manner? That's why, and I'm standing at a place which used to, in fact, always show the pollution levels in the national capital, that board has been switched off. Do you feel that much more needs to be done in this fight, rather than, of course, trying to change standards or give, in fact, these twists that data is not credible, sir?
Yes, first of all, I think for any action that we need to take, we must have credible data. Data is something that will help us and guide us as to what we can do. Data to tell us that what is the level that we are being exposed to, what are the emissions where are the emissions coming from, what is the type of particulate matter, and what is the other noxious substances that we are seeing in the air, and then what are the measures that we can take which are practical, sustainable, and can be done for our own country. So I think first issue is to accept that there is a problem. I think it's pretty visible. Anyone who goes to the Indo-Gangetic belt travels doesn't need to carry or see the AQI. He can feel the fact that the air that he's breathing is not of good quality. There are a lot of respiratory symptoms that develop, and if you continue to breathe such bad air, you are going to have long-term problems, especially children and the elderly. So I think it's important for us first to accept that there is a problem. We need to have data, and then we need to work as together, policymakers, scientists, common man. Everyone needs to come together to see what we can do to really find a strategy to really decrease or improve the quality of air and decrease the poor air that we're seeing not only in Delhi but in the Indo-Gangetic plain.
Absolutely. Thank you so much, Dr. Guleria, for your time, sir.